All right, so let's get into the questions that have been submitted, but we're going to start first with the numbers. We want to know positive cases in the county, in the hospital, and just the numbers that we cover every week.
Yeah, and I'll kind of blaze through these. I know I think I found myself last week spending a significant amount of time on it, and but I'll try to cut through quickly so I can certainly spend the time on the other questions, and then ideally we have some that come in on the chat too.
Right.
So starting at the state level, amazingly that the state of California now is reporting they've conducted 2.5 million COVID tests now since the start of the pandemic statewide. Obviously, Kaweah Delta is a big part of that testing. And of the 2.5 million tests that the state has conducted, just a little over 136,000 have tested positive. Unfortunately, we've had almost 4,800 deaths now at the statewide level. There are currently 3,240 California residents that are hospitalized with the COVID virus, and about a third of them, just shy of 1,100, are in the intensive care units. With respect to healthcare workers, statewide, about 11,400. And we've had 67 California healthcare workers that have passed as a result of the COVID virus. At the county level, again, state level, 136,000 positive. For Tulare County, just slightly more than 2,400. Fortunately, we're seeing more and more cases recovered. So the county has reported now of those 2,400 that tested positive, 1,600 have now successfully defeated the virus and have fully recovered. We have had 96 deaths, again, since the start of the pandemic. I thought you might find it interesting. I think this question comes up often. Of those 96 deaths countywide, 80 of them pertain to nursing home residents. So without a doubt, the nursing homes in Tulare County were hit the hardest among their residents and among their healthcare workers. So very sad to have experienced that. But and there are currently 994 Tulare County residents that have tested positive but are under quarantine, generally at home, recovering. The thing that comes up often, and I think is one of the most important things, is what I call the positivity rate. Not a term that I made up, but essentially it's of all those people that you test, what percentage test positive for the virus? And you may recall that a number of weeks ago, probably at the height of the outbreak, the county was running probably close to 15% of all those out there were testing positive. Which probably is not that surprising. It kind of mirrored what we were seeing at Kaweah Delta, but at that time we were only testing patients that were showing symptoms, that were exhibiting and more likely than not to be positive. More and more now we are testing asymptomatic patients. Definitely when we started back up with elective surgeries, we now test all of those patients, and virtually all of them have been asymptomatic. And I think you'd be interested to know that we've now tested probably about 600 elective surgical cases. So we test them generally within 48 to 72 hours of having their procedure. Again, many of them are outpatient surgeries, but we're doing anywhere from 8 to 10 elective inpatient surgeries a day. We're back to doing colonoscopies and bronchoscopies and things in the endoscopy labs, but we're also testing those patients before their procedures. And of those 600 that we've tested, only 2 tested positive.
And their surgeries were canceled?
Their surgeries were canceled, rescheduled, obviously quarantining at home, and hope to have them back real soon. But so the positivity rate that the county, they're actually out there reporting it, not daily, but pretty close to it. I just looked at the website this morning, and the positivity rate now stands at 7.5% countywide. Now that's up from about a week ago.
Oh.
A week ago we were at 5.7%, well below the 8% threshold that was set by the governor to allow us to move into phase 2.5. Now tomorrow, Tulare County moves into phase 3, which we'll talk about, but we're in phase 2.5 right now, and the only reason we were allowed to go into it is because our positivity rate fell below 8%. So,
and it's what now, 7 point?
It's 7.5% now. It was 5.7% last week. I mean, you definitely are seeing, in terms of the absolute number, more and more people testing positive. Just the other day, the county reported 161 new positive cases just in a single day, which is probably one of our highest single day rates that we've seen over this entire almost 4-month period now. But it's definitely been declining. Mm-hmm. So, but again, the more and more people that we're testing, and Kaweah Delta is experiencing the same thing. We're doing so much more testing. Mm-hmm. There are 22 specimen collection sites across Tulare County now. So you're just going to see the absolute number go up, but what's most important is that positivity rate. And to keep it below 8%, I was really hoping that we'd continue to see it decline from that 5.7, but we also have been expecting, a couple weeks after Memorial Day, starting to open up under 2.5, that we were going to start seeing a higher outbreak rate. So that's what we actually are experiencing.
I think they said in our leadership meeting yesterday that our Floral site, did they say like 180, they're averaging 180 tests a day there now?
Yeah, and the county just got all brand new equipment. So the county doesn't do specimen collection, but they do testing. And so these 22 specimen collection sites, the states that went up in Porterville and in Dinuba, a lot of doctors' offices now are collecting specimens. So they're sending those to the county, and they're now able to process 200 tests a day, significantly greater than the 30 that they were able to process, back in the early days of the pandemic.
And the county, do you get the results back sooner with the county versus like Quest?
Yeah. Kaweah Delta, ours is almost real time. If we run it on the Abbott ID Now platform, we have results back within 30 minutes. If we run it on the BD Max, it's back in a couple hours. The county is generally about a 24-hour turnaround. But unfortunately, we're continuing to hear that Quest, which is, I think, the only commercial lab that's actually processing specimens, is still running 7 to 10 days. So very frustrating. I know if you're a patient, a community member, that you probably got the specimen collected, you were probably asymptomatic, but your physician went ahead and collected the specimen, and then they send it to the commercial lab, and you sit there and you wait. And I know that's frustrating. Right. So lastly, here at Kaweah Delta, we have 29 positive COVID patients that are in the hospital right now. 5 are in the ICU. 6 are in the intermediate critical care unit, so that's between ICU and general medical surgical. And then 18 patients on 2 South, which is kind of our dedicated respiratory unit. We pretty much are admitting COVID patients only to the ICU, the ICCU, which is on 3 West, the west side of the hospital, which is a 30-bed unit, and then 2 South, which is a 29-bed unit. So all of our COVID patients are generally confined to those 3 areas. And right now, today, we have 26 beds among those 3 units that are open. Okay. So we do have surge capacity. I'm glad to see our number of COVID patients below 30. We did see a spike not too long ago. We were hitting mid-30s to high 30s, but have seen that recently drop back down into the 20s, albeit just barely below 30. So I'm often asked, again, about ventilators. That is one of the metrics that the state looks at. So I've mentioned this in the past. We own 96 adult ventilators. Currently, there are 36 that are in use. A couple of them for COVID patients, but all the others are cardiac surgery and strokes and pneumonia and just typical things where the patient needs help breathing. So that leaves us 60 currently unused ventilators. So again, good position in the event of a resurgence.
Right.
I mentioned we've now collected 8,700 specimens, almost entirely at the Floral Street address. We are working to close Floral Street down and to move it over to our what we call our South Campus. So the Urgent Care Center on Court Street, just north of Walnut. We will be moving the specimen collection site to there, which will give us indoor capability. So obviously we're entering the hot season, and having our staff and patients outdoors on Floral is starting to get a little bit uncomfortable. So we hope to have that up and running in about another week and a half.
Plus, once Main Street gets back, businesses start
Yes.
opening.
Yeah,
Floral
exactly.
will become
So
very,
we'll
yeah.
open back up Floral. So. And then lastly, folks always ask, what about Kaweah Delta employees? So I mentioned that there have been a little over 11,000 healthcare workers infected statewide, so we're not immune from that. I think we've done a pretty phenomenal job. I applaud our staff for just their vigilance, their diligent use of protective equipment and so forth. But throughout this entire infection, we've had now 101 of our healthcare workers that have been infected. 57 have fully recovered and returned to work. We have another 44 that are home, quarantined, waiting to anxiously come back to work. And we have one of our patients that is still hospitalized. And then among physicians, among the medical staff, we've had 4 providers. And you think about that over 4 months. And our physicians are right there on the front line in the ICU and the ED and on 2 South. But only 4 have been infected. 3 have fully recovered, returned to work, and 1 is home recovering right now.
Okay.
So those are